Negative pressure wound therapy, or a wound vac, is a device used to help promote closure, healing, manage drainage, and decrease infection risk in wounds. In our facility, we have three types of wound vacs: the ActiVac, the Provena or temporary vac, and a Veriflow, which has saline in it. The ActiVac is our most common vac. Wound dressing changes can be painful. Assess the patient's pain level to see the need for medication prior to the dressing change. If giving medication, please wait 30 to 45 minutes before starting. While you are waiting, you can get your supplies needed and ensure that you have an order in the computer. This is a list of the supplies that you may use whenever you are doing a wound vac change. You will need the vac itself, a wound vac supply packet that includes foam, drape, pad tubing, and a measurement device, white foam in case there is undermining or tunneling, scissors, wound cleanser or normal saline, Q-tips for measurement, sterile gauze, skin prep, adaptic or Vaseline gauze, a new canister for the vac, a mask for you and the patient if it is a chest wound, a box of gloves or gloves nearby that are accessible, a disposable chuck, and an iPad with a patient sticker. When setting up to perform a wound vac change, position the patient comfortably in bed and put the bed at an appropriate height for you. Set up the machine with the canister and plug the cord in, but don't turn it on yet. The cord should be plugged in any time that the patient is in bed. Place disposable chucks down on the bed or bedside table and place supplies on top, within arm's reach, but not in the way of the patient. Explain every step you are performing to the patient and the family member so that they know what is going on. This can be a very scary time for them if they have never experienced a wound vac dressing change. Once you are set up, perform hand hygiene and then apply gloves. Remove and assess the old dressing. Notice if there is any wound exudate and how many pieces you are removing. With a gloved hand, cleanse or irrigate the wound and pat the area dry, following a clean technique. Now that the wound is clean, we're going to take some pictures with the iPad. Whenever you take the picture, ensure that the patient sticker is visible and legible. Also, include a measurement guide in your picture. After you take your picture, clean the iPad and change your gloves. Next, use your measurement device and Q-tip to take measurements of the wound. Whenever you are documenting, the first number is length, the second number is width, and the third number is depth. While you are measuring, assess for tunneling or undermining. Assess the wound appearance, color, and exudate. Apply skin prep to the peri-wound and allow to dry. Change gloves. Next, we will be performing a technique called window painting. Window painting is important because it protects the peri-wound from skin damage. Whenever you are window painting, you will use the drape found in your wound vac supply packet. You will cut the drape into strips and place them around the wound. Whenever you are placing the drape, you will remove it in the order listed on the drape. The drape is numbered with 1s and 2s to identify which area you remove first and second. Once the drape is put onto the person, it will not stick if it is removed. If undermining or tunneling are present, use white foam to fit the wound dimensions. Make sure you take note of how many pieces you place. Cut the black foam to fit the wound without overlapping onto the intact skin. Gently place foam into the wound cavity, ensuring contact with all wound surfaces. Trim and place drape to cover foam dressing and add an additional 5 cm border of intact drape to the peri-wound so that the entire wound is sealed. Remember, do not pull the drape tightly, just gently place it. Whenever it is tight, it can cause pain or skin irritation. Choose the pad or tubing application site with considerations of the patient's position, comfort, and safety in mind. Remember, laying on the tubing can cause a pressure injury. If the patient's wound is on the back side of their body, they may need a bridge around to the front to prevent them from laying on the tubing. Cut a hole about a quarter size through the drape where you are going to place the pad. Place the pad opening directly over the hole you cut and pull on the blue tab to remove the cover. If the patient has an abdominal wound and an ostomy, consider placement to prevent interruptions with either device. Ensure both devices have and are able to maintain their seal to prevent cross-contamination. Using other wound care supplies may aid in preventing the two areas from leaking. Items that may aid in this are Cavalon, Duoderm, Skin Prep, and Vigilance with cutting drape or the ostomy wafer. Make sure you place a wound consult for all ostomies. Now that your dressing is in place, connect the tubing and turn on the machine. Confirm the settings and then begin treatment. Ensure that the dressing collapses. Monitor the patient for a few minutes to make sure that there are no leaks. Continue the therapy as ordered. Document placement each shift after visualizing the compressed dressing and ensuring there are no leaks. Change the dressing every 48 to 72 hours, but no less than 3 times a week. If the dressing is left in place without active vac therapy for more than 2 hours, remove the old dressing and irrigate the wound, then replace with a new dressing. If the vac cannot be continued at this time, use a wet to dry dressing. If a Veriflow has quit working, it can be switched to an ActiVac. If that is unsuccessful, then place a wet to dry dressing. When switching from a Veriflow to an ActiVac, ensure that the saline tube is clamped. Place or continue the vac at admission. If the vac is unable to be placed or continued, contact the provider for further instruction. Make sure you place a wound consult for all wound vacs. If the machine alarms, assess the patient as well as the machine. The screen on the machine may tell you what the alarm is for. Most alarms are either a leak, which you could hear or see in the dressing and can be reinforced with drape, a blockage or kink in the tubing, a canister full, or the battery low. If you are unsure and unable to fix the issue, contact the wound care office or call the 1-800 number on the machine for KCI assistance. If the patient is leaving LOA to acute care, remove the vac. You do not need to take down the dressing, but do not send the machine with them to another facility. When you remove a vac, place it in the soiled utility room along with the cord. Contact purchasing to come get the vac. Don't forget to participate in a wound vac class every other year. Thank you for everything you do.